My name is Dr. Mehta. I practice pulmonary, critical care, and sleep medicine, and I've been here at Somerset Medical Center for 5 years now. My patient care philosophy is basically make the patients my own. I make it my mom, my dad, somebody I think about on a daily basis, and apply it to the patient the way I would to my mother or father. And I think that changes the whole level of the game. I think often we're taught to separate the doctor-patient relationship, and I don't think that works. I generally go against that, because then you become not one with the patient. You make it your family member, and what would happen if this was them, and how would you treat them? I think it changes everything you do. I think the unique thing about the Steeplechase Cancer Center is that it's right here. It's in central New Jersey, and the team is phenomenal. The doctors are high class. Well-trained. You can't find them anywhere else. You can go to New York or Philadelphia, but I think that makes it very difficult for patients. They do go there and get an opinion, and usually find out that the opinion they get is the same one that they've gotten here. This is in their backyard, and we're the community. We know the patients. We work where we live, and so we know these patients as neighbors, as people we run into in restaurants or malls, and so it becomes different than just a doctor-patient, or you went to New York and met a doctor that you've never met but heard about. Here, it's your neighbor, it's your friend, it's somebody that you know well, and they treat you as that. I think the unique thing about the team approach here is, given the size of our hospital, everybody is in daily communication. So when I've trained at larger centers, you didn't really talk with other doctors. You kind of looked at the chart, reviewed what they wanted to do. Here, you pick up a phone, you send them a text message, an email, and you get instant feedback. Hey, listen, I saw John Smith, and this is what I'm thinking. What do you think? No, don't do that. Or, yeah, go ahead and do that. I agree. I didn't think about that myself. And so it becomes more of a team approach. Everybody says they have a team approach, but I think here the communication opens it up to make it a true team approach. I think the most rewarding thing about being a doctor, especially here at Somerset Medical Center and working with the Steeplechase Cancer Center, is working with the patients and their families. Making the diagnosis is one part of the job, but when I think back about my days that were great days that I go home and can't stop thinking about, are the days when I work with patients and their families, deal with their diagnosis and the ultimate outcomes of those diagnoses, whether it be a great outcome or not the one that we were hoping for. You do it with decency, with some dignity, and make sure that the patient at most is comfortable. That puts the patients and their family members at ease, and you go home feeling good about yourself.